Good morning, everybody. My name is Kaylee,
My name is Halima.
and we are here today from the University of Charleston School of Pharmacy. Does anybody here know where the University of Charleston is? Okay, awesome. Yeah, so it's right across the river, close to your old school. Does anybody know what a pharmacist is? Okay, awesome. Yeah, so the pharmacist is the doctor at the pharmacy who gives you all your medicine when you're sick. So today we're here to teach you all about medication safety. So today's discussion is called Generation RX, and today we're going to teach you all about the potential dangers of misusing your medication, but we're also going to teach you how to use your medication correctly. So we have 3 objectives today. We're going to teach you 5 steps to be medication smart. We're going to teach you what asthma is and how it works on your body, and we're also going to teach you how to get rid of your medications when they're old. So the first step of being medication smart is to make sure that your name is on the prescription bottle, and you're also going to want to know why you're taking the medicine. So if you have asthma, you're going to know that you use your inhaler for your asthma and that your name is on your inhaler. The second way to be medication smart is to know when you take your medicine, when not to take your medicine, and for how long you need to take it. So if you're outside playing on the playground and you start to feel hard to breathe, then you know that you need to take your inhaler. But if you're inside in your classroom coloring and you're perfectly fine, there's no reason to use your inhaler. The third way to know how to be medication smart is to know what foods, drinks, and other medicines make your activities to avoid while you take your medicines. And we also need to know if there's any side effects, what they are, and what to do if they occur. So a side effect would be when you take your inhaler, sometimes you cough, or if you take your Benadryl, maybe if you have a rash, you get really sleepy. That would be a side effect. And the 5th way to be medication smart is to know RX. So does anybody know what this is up on the board? Okay, awesome. Yeah, it is a medication bottle. So on the medication bottle, RX has a shirt on. Does anybody know what this shirt would be called? Yeah, it's a label. Awesome. So on the label, there are some really important things on the medication that we need to know, and I'm going to teach you that right now. So this is the label that was on Rex's shirt, and it has some really important things on it. At the top, you're going to see the pharmacy that your guardian, your mom, your dad, your grandparents got your medication at, and you're also going to have the address. The next one down is the identification number, which isn't too important for you, but it's kind of like your school lunch number. The next one is your name, so you always want to make sure that your name is on the medicine. And then under that, it's going to let you know how you take your medicine, the type of medicine, how many refills you get, so how many times you can go back to the pharmacy and get more. It's also going to show you the expiration date, which is really important. That's when you throw your medicine out. And then at the top, it's going to tell you the doctor that you went to get your medicine, the phone number if your parents or grandparents need to call the pharmacy, and also the date that you got the medicine. So next is the auxiliary labels. These aren't going to be too important for you because you are not going to be getting your medication. Your guardians are going to be getting the medication for you. But these labels are going to let you know the warnings of your medication. So for example, maybe you don't need to take your medication with milk. Don't take this medication with other medicines. Or you should drink a lot of water when you take your medicine. So the whole point of this lecture is we want to make sure that you take your medicines as prescribed, so as your doctor tells you to. You don't ever want to share your medicines, and you always want to finish the medicine just like the doctor told you to. So now we're going to teach you all about asthma. And asthma is a disease that affects your lungs, and it makes it really hard for you to breathe. And these are asthma triggers, and these are just things that if you have asthma, they can bother your asthma. So maybe pollen, which comes off flowers and trees. So maybe when you're outside, your asthma gets a little worse. Maybe smoke, dust, so make sure you clean your rooms. Exercise, so outside when you play on the playground, or maybe if you get stressed out. So in order to control your asthma, you have to know what makes your asthma worse. So maybe when you're outside playing on the playground, you know that sometimes it makes it hard for you to breathe, so sometimes you have to take it a little bit easier when you're outside for recess. You have to take your asthma medication as prescribed. And you also have to track your asthma, so maybe your parents, your guardians, or your teachers can help you do that so that you know when your symptoms are getting worse, you can stop what you're doing and use your inhaler.
All right, so speaking of inhalers, for controlling asthma, there are many different types of devices that you use, like an inhaler or a maintenance inhaler that's a little bit bigger that you use every day, or a nebulizer, which is this. So how to use your medication device. Does anybody here know how to use their inhaler? All right, good job. So I'm just going to show you how to use an inhaler, which is in my hand right now. Yeah. You just want to remove the cap and hold the inhaler upright. Shake the inhaler to make sure the medication is really mixed up really well in there. Tilt your head back and slightly breathe out. Hold the inhaler upright again and press down slowly and inhale the medication as you go. And hold your breath for 10 seconds. Oh my God, 10 seconds. And you usually have to do 2 puffs at a time, so wait a minute between each puff. And also you can have your parent or your guardian help you do this. Now we're going to talk about what you do when your medication is no longer needed, so how to get rid of it. So we all know that medicines are important for treating all our diseases and any conditions that we may have. So when you no longer need them, you have to get rid of them correctly. Why do you think we need to do this? Good, because we don't want anybody using our medication that shouldn't be using it, and then make sure that it's safe and away from people that we care about. And also for harming the environment, which we also don't want, of course. So do you think that pouring medication into the trash is a safe disposal method? Yes. Wrong. It is not, because trashes are not really secure and anybody can get into it, your pets, your siblings. So we want to keep other people safe, of course. Do you think flushing pills down the toilet is a safe disposal method? Yes. No. No, if you flush medication down the toilet, it can get into our water system and make a lot of people sick, and we don't want that. So how are we supposed to get rid of our unused medications? So there's a few things that we can do. There are drug take-back programs. So I know certain hospitals and police stations often take back unused medications. There are also these fancy little purple bags that are going to be available here at the school for you guys. If you want to get rid of your medications, you can have your parents or guardians come and pick one up so they can get rid of their medications safely. So what have you guys learned today? Okay, that's great. You guys really grasped the topics. But let's have us summarize. You want to take your medications as they are prescribed. You don't want to take anything you don't have to take. Don't share your medications with anybody. The same way you wouldn't share your clothes or your underwear, hopefully, with other people. You want to share your medications. Asthma-wise, so now you learned about asthma. So those of you who have asthma know how to control your triggers and how to keep watch on that, and to dispose your medications properly to keep everybody safe. Okay, well, I had such a great time talking about this. And we hope that everybody can be medication smart. Yay!